I'm Babette Edgar, and I'm here with Elaine Manieri today, and we're talking about the future of managed care. Elaine, can you tell me a little bit about your role and what you do now?
Sure. I work for Blue Cross Blue Shield of Tennessee, and I'm the Vice President of Pharmacy Management. So we're responsible for all lines of business, developing the pharmacy benefit, working on quality initiatives as far as pharmacy goes. Medicare is a huge part of our focus and our business. So I have several pharmacists that work for me, as well as pharmacy techs and analysts.
And how long have you been in managed care?
Oh, I've been in managed care since 1995.
So you've seen a lot of changes in
Yes.
managed care.
Yes.
So, it'll be interesting to understand your perspective as you've been in managed care for so long, and now we're talking about the future
Yes.
and what you think is going to happen in the next 5 to 10 years. So if you had your crystal ball out, how do you think managed care is going to be practiced in areas such as Medicare, Medicaid, employer benefits in the next 5 to 10 years?
And are we talking specifically pharmacy managed care?
Pharmacy managed care.
Yes.
Yeah.
I think pharmacists are going to take a bigger and bigger role in managing health care in the future. I think it's up to pharmacists, though, to do it. And it's our opportunity right now in order to step up and practice what we know, practice what we've been taught, and everything about medication management, working with patients, giving direct patient care. We're going to have a shortage of physicians, and we already do have a shortage of primary care physicians.
Yes.
And we're going to need more and different practitioners to step up and help take care of these patients. So for instance, diabetes is the perfect example where pharmacists can practice managed care principles, managing their patient, managing their medication, teaching them how to take their drugs the right way, monitoring, everything that they need to monitor. Pharmacists can do that for the patients. We're moving into such a regulated environment, and it's really high focused on quality. So with the Medicare, looking at the stars, that's going to become our norm. As the exchanges roll in and become more mature, we're going to have more and more of those quality measures that we can affect as pharmacists.
And do you think, as pharmacists, that we're doing a good enough job educating our students to be able to practice in these settings, both from a teaching standpoint in the schools as well as postgraduate residencies? And do you think there's going to need to be some specialization in those residencies in managed care moving forward?
I'll start with your first question about are we doing a good job in educating our future pharmacists. I think we've come a long way in the last 15 years. However, I think we have a long way to go. There's still a very, very high focus in pharmacy schools on the clinical aspects, which we need, but looking at retail and hospital still as kind of your only two options or your main options, where we need to open up the eyes of our students to say there's so much more in the world of pharmacy. If you have a pharmacy degree, you can do just about anything with it. So I would like to see some more special curriculum in the pharmacy schools as it applies to managed care. As we go into the residencies right now, we have come a long way in managed care pharmacy residency, but they're still pretty much general. There's not a lot of specials. We've done some medical informatics, which I think is good and is very much needed. I believe that we need to have a focus on specialty pharmacy management. That's where we really have to place a lot of management techniques, our area of expertise, in order to produce a quality health care for our patients, but also keep the costs down as much as we can, which is going to be very, very difficult. So those are two areas that I see as far as specialization in the residency programs. The other main area is more in the regulatory environment, because we are moving into Medicare kind of regulations, Medicaid type of regulations as the norm. this is something we as pharmacists need to be informed and need to know about.
Well, great. Thank you very much for your time today.
You're welcome. Thank you.